Preventing the spread of coronavirus disease 2019 (COVID-19) in homes and residential communities. Please hit the like button and subscribe for more videos. This guidance provides clarification regarding evaluation for home isolation and a new section with information regarding preventative steps for household members, intimate partners, and caregivers in a non-healthcare setting of a person with symptomatic, laboratory-confirmed COVID-19. This interim guidance is based on what is currently known about the epidemiology of COVID-19 and the transmission of other viral respiratory diseases. CDC will update this interim guidance as needed and as additional information becomes available. Coronaviruses are a large family of viruses, some causing illness in people and others that circulate among animals, including camels, cats, and bats. Rarely, animal coronaviruses can infect people exposed to infected animals, and then spread among people, as has been seen with MERS-CoV and SARS-CoV, and likely now with SARS-CoV-2, the virus that causes COVID-19. This interim guidance may help prevent this virus from spreading among people in their homes and in other residential communities. Prevention steps for people with confirmed or suspected COVID-19, including persons under investigation, who do not need to be hospitalized, and people with confirmed COVID-19 who are hospitalized and determined to be medically stable to go home. Your healthcare provider and public health staff will evaluate whether you can be cared for at home. If it is determined that you do not need to be hospitalized and can be isolated at home, you will be monitored by staff from your local or state health department. You should follow the prevention steps below until a healthcare provider or local or state health department says you can return to your normal activities. Stay home except to get medical care. You should restrict activities outside your home, except for getting medical care. Do not go to work, school, or public areas. Avoid using public transportation, ride-sharing, or taxis. Separate yourself from other people and animals in your home. People, as much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom, if available. Animals, you should restrict contact with pets and other animals while you are sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people sick with COVID-19 limit contact with animals until more information is known about the virus. When possible, have another member of your household care for your animals while you are sick. If you are sick with COVID-19, avoid contact with your pet, including petting, snuggling, being kissed or licked, and sharing food. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with pets and wear a face mask. See COVID-19 and animals for more information. Call ahead before visiting your doctor. If you have a medical appointment, call the healthcare provider and tell them that you have or may have COVID-19. This will help the healthcare provider's office take steps to keep other people from getting infected or exposed. Wear a face mask. You should wear a face mask when you are around other people, e.g., sharing a room or vehicle, or pets, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then people who live with you should not stay in the same room with you, or they should wear a face mask if they enter your room. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in a lined trash can. Immediately wash your hands with soap and water for at least 20 seconds or clean your hands with an alcohol-based hand sanitizer that contains 60 to 95% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water should be used preferentially if hands are visibly dirty. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds or clean your hands with an alcohol-based hand sanitizer that contains 60 to 95% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water should be used preferentially if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid sharing personal household items. You should not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people or pets in your home. After using these items, they should be washed thoroughly with soap and water. Clean all high-touch surfaces every day. High-touch surfaces include counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Also, clean any surfaces that may have blood, stool, or body fluids on them. Use a household cleaning spray or wipe, according to the label instructions. Labels contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during use of the product. Monitor your symptoms. Seek prompt medical attention if your illness is worsening, e.g., difficulty breathing. Before seeking care, call your healthcare provider and tell them that you have, or are being evaluated for, COVID-19. Put on a face mask before you enter the facility. These steps will help the healthcare provider's office to keep other people in the office or waiting room from getting infected or exposed. Ask your healthcare provider to call the local or state health department. Persons who are placed under active monitoring or facilitated self-monitoring should follow instructions provided by their local health department or occupational health professionals, as appropriate. If you have a medical emergency and need to call 911, notify the dispatch personnel that you have, or are being evaluated for COVID-19. If possible, put on a face mask before emergency medical services arrive. Discontinuing home isolation. Patients with confirmed COVID-19 should remain under home isolation precautions until the risk of secondary transmission to others is thought to be low. The decision to discontinue home isolation precautions should be made on a case-by-case basis, in consultation with healthcare providers and state and local health departments. Recommended precautions for household members, intimate partners, and caregivers in a non-healthcare setting: 1 of a patient with symptomatic laboratory confirmed COVID-19. Or a patient under investigation. Household members, intimate partners, and caregivers in a non-healthcare setting may have close contact too with a person with symptomatic, laboratory-confirmed COVID-19 or a person under investigation. Close contacts should monitor their health. They should call their healthcare provider right away if they develop symptoms suggestive of COVID-19, e.g., fever, cough, shortness of breath. See Interim U.S. Guidance for Risk Assessment and Public Health Management of Persons with Potential Coronavirus Disease 2019, COVID-19, exposure in travel-associated or community settings. Close contacts should also follow these recommendations. Make sure that you understand and can help the patient follow their healthcare provider's instructions for medications and care. You should help the patient with basic needs in the home and provide support for getting groceries, prescriptions, and other personal needs. Monitor the patient's symptoms. If the patient is getting sicker, call his or her healthcare provider and tell them that the patient has laboratory-confirmed COVID-19. This will help the healthcare provider's office take steps to keep other people in the office or waiting room from getting infected. Ask the healthcare provider to call the local or state health department for additional guidance. If the patient has a medical emergency and you need to call 911, notify the dispatch personnel that the patient has, or is being evaluated for COVID-19. Household members should stay in another room or be separated from the patient as much as possible. Household members should use a separate bedroom and bathroom, if available. Prohibit visitors who do not have an essential need to be in the home. Household members should care for any pets in the home. Do not handle pets or other animals while sick. For more information, see COVID-19 and animals. Make sure that shared spaces in the home have good airflow, such as by an air conditioner or an opened window, weather permitting. Perform hand hygiene frequently. Wash your hands often with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer that contains 60 to 95% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water should be used preferentially if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. You and the patient should wear a face mask if you are in the same room. Wear a disposable face mask and gloves when you touch or have contact with the patient's blood, stool, or body fluids, such as saliva, sputum, nasal mucus, vomit, urine. Throw out disposable face masks and gloves after using them. Do not reuse. When removing personal protective equipment, first remove and dispose of gloves. Then, immediately clean your hands with soap and water or alcohol-based hand sanitizer. Next, remove and dispose a face mask, and immediately clean your hands again with soap and water or alcohol-based hand sanitizer. Avoid sharing household items with the patient. You should not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items. After the patient uses these items, you should wash them thoroughly. See below, wash laundry thoroughly. Clean all high-touched surfaces, such as counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables, every day. Also, clean any surfaces that may have blood, stool, or body fluids on them. Use a household cleaning spray or wipe, according to the label instructions. Labels contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during use of the product. Wash laundry thoroughly. Immediately remove and wash clothes or bedding that have blood, stool, or body fluids on them. Wear disposable gloves while handling soiled items and keep soiled items away from your body. Clean your hands with soap and water or an alcohol-based hand sanitizer immediately after removing your gloves. Read and follow directions on labels of laundry or clothing items and detergent. In general, using a normal laundry detergent according to washing machine instructions and dry thoroughly using the warmest temperatures recommended on the clothing label. Place all used disposable gloves, face masks, and other contaminated items in a lined container before disposing of them with other household waste. Clean your hands with soap and water or an alcohol-based hand sanitizer immediately after handling these items. Soap and water should be used preferentially if hands are visibly dirty. Discuss any additional questions with your state or local health department or healthcare provider. Interim guidance for implementing home care of people not requiring hospitalization for 2019 novel coronavirus 2019 nCoV. This interim guidance is for staff at local and state health departments, infection prevention and control professionals, and healthcare personnel who are coordinating the home care and isolation of people with confirmed or suspected 2019 nCoV infection, including persons under investigation. See criteria to guide evaluation of persons under investigation (PUI) for 2019 nCoV. This includes patients evaluated in an outpatient setting who do not require hospitalization, i.e., patients who are medically stable and can receive care at home, or patients who are discharged home following a hospitalization with confirmed 2019 nCoV infection. In general, people should adhere to appropriate transmission-based isolation precautions until the risk of secondary transmission is thought to be low. Current information on 2019 nCoV is limited, thus home precautions should be conservative based on general recommendations for other coronaviruses, like Middle Eastern Respiratory Syndrome (MERS), and may last up to 14 days. This document does not apply to patients in healthcare settings. For interim healthcare infection prevention and control recommendations, see Interim infection prevention and control recommendations for patients with known or persons under investigation for 2019 novel coronavirus 2019 nCoV in a healthcare setting. CDC will update this interim guidance as needed and as more information becomes available. Assess the suitability of the residential setting for home care in consultation with state or local health department staff. A healthcare professional should assess whether the residential setting is appropriate for home care. Considerations for care at home include whether the patient is stable enough to receive care at home. Appropriate caregivers are available at home. There is a separate bedroom where the patient can recover without sharing immediate space with others. Resources for access to food and other necessities are available. The patient and other household members have access to appropriate recommended personal protective equipment, at a minimum, gloves and face mask, and are capable of adhering to precautions recommended as part of home care or isolation, e.g., respiratory hygiene and cough etiquette, hand hygiene. There are household members who may be at increased risk of complications from 2019 nCoV infection, e.g., people greater than 65 years old, young children, pregnant women, people who are immunocompromised or who have chronic heart, lung, or kidney conditions. Provide guidance for precautions to implement during home care. A healthcare professional should provide CDC's interim guidance for preventing 2019 novel coronavirus 2019 nCoV from spreading to others in homes and communities, to the patient, caregiver, and household members, and contact their state or local health department to discuss criteria for discontinuing any such measures. Personal protective equipment recommendations. Based on the current COVID-19 situation and availability of personal protective equipment (PPE), CDC has specific recommendations, summarized below. As we learn more about COVID-19 and as the needs of the response or availability of PPE within U.S. healthcare facilities changes, we will update our guidance. Who needs PPE? Patients with confirmed or possible SARS-CoV-2 infection should wear a face mask when being evaluated medically. Healthcare personnel should adhere to standard, contact, and airborne precautions, including the use of eye protection, e.g., goggles or a face shield, when caring for patients with SARS-CoV-2 infection. These precautions include the use of PPE, including NIOSH-approved N95 respirators, gowns, gloves, face shield, eye protection, etc. This includes, but is not limited to, surgical N95 respirators. Who does not need PPE? CDC does not currently recommend the general public use face masks. Instead, CDC recommends following everyday preventive actions, such as washing your hands, covering your cough, and staying home when you are sick. Manufacturers and distributors. Cases of COVID-19 are being reported in China as well as other countries. Given decreases in exports from select countries, e.g., China, India, Taiwan, and increases in demand due to the outbreak, manufacturers of select types of PPE are reporting increased volume of orders and challenges in meeting order demands. Plans to surge manufacturing globally are underway. Thank you for watching. Please hit the like button and subscribe for more videos.